If getting up from the floor has become a whole event for you, if climbing one flight of stairs leaves your knees aching for the next hour, if your morning starts with that familiar stiffness, that tight, grinding, creaking feeling before you have even taken 5 steps, and if someone told you, a doctor, a family member, maybe yourself, that this is just what happens after 50 and you just have to live with it, I need you to hear this right now. That is not true, and the thing most people your age are doing every single day is actually making it significantly worse. Stay with me, because what I'm going to share today changed how many of our members at odds think about their knees and their movement completely. Let me paint a picture that I think a lot of you will recognize. You wake up in the morning, first thing you do is try to get out of bed. And before you have even stood up fully, the knees are already talking to you. That dull ache, that stiffness. You need a moment, you stand, you wait for them to warm up, and you slowly make your way to the bathroom. By mid-morning, they loosen up a little and things feel okay. But then comes the afternoon. You sat for 2 hours. You get up again, stiff again. That familiar tightness right under the kneecap, or on the side of your joint, or all around it. Stairs are a negotiation, going down worse than going up. Sitting on the floor for a puja or a family gathering or just a play with a grandchild, that was quietly becoming something you dread or avoid. You went to a doctor, they did an x-ray, they said grade 2 or grade 3 arthritis, cartilage is wearing down, take this anti-inflammatory, avoid squatting, avoid stairs if you can, lose weight, come back if it gets worse. So you rest more, you move less, you protect the knees by not using them. And 3 months later, they hurt more. This is the trap, this is the mistake, and this is happening to millions of people in India over 50 every single day. Resting is not actually the answer. In fact, for most people with knee pain, rest is one of the worst things you can do. And I'm going to explain exactly why and what to do instead. Hello everyone, I am Prateek, longevity expert and VP of Odds Academy. At Odds, we work with people across all age groups on movement, longevity and quality of life. And knee pain, particularly in people above age of 50, is one of the most common things we deal with. Not just managing it, reversing it, improving it, getting people back to movement they had given up on. Today, I want to give you a real, honest, practical understanding of what is actually happening in your knee and the single biggest daily mistake that is keeping you stuck in pain, along with exactly what to do about it. No surgery talk, no scary language, just clear, action-enable information that you can start using today. First, if you have been living with knee pain for months or even years and you have started accepting it as just your life now, I want you to gently push back on that. You are not broken. Your knees are not beyond help, and you are absolutely not too old to improve this. I have worked with people in their 60s and 70s who had significant arthritis, who had been told to prepare for knee replacement, who went on to walk 5 kilometers pain-free, climb stairs comfortably, sit on the floor and get up without help, and after working on the right things for 3 to 6 months. Not every case, not everyone gets 100% back, but the range of improvement possible when you address the actual root causes is far greater than most people are told. So please, do not accept the story that your knees are finished just because of a number on an X-ray or because of your age. Your knee joint has no direct blood supply to its cartilage. Read that again. The cartilage inside your knee, the cushioning tissue that everyone is worried about when they hear arthritis, gets all of its nutrition through something called the synovial fluid. That is the joint fluid inside your knees. And here is the critical part. Synovial fluid circulates and delivers nutrients to the cartilage only through movement, specifically through the compression and decompression that happens when you move your knees through its range of motion. When you rest, when you stop moving, that cartilage gets less nutrition. It becomes more brittle. The cells inside it starts to deteriorate faster. So when your doctor says rest the knee and you sit more, walk less, avoid stairs, you are literally starving your cartilage of the only nutrition it can receive. Movement is not the enemy of arthritic knees. The right movement is the medicine. This one idea, once it settles in, changes how you approach everything. Let me explain the knee simply so you can understand what you're dealing with. Your knee is a hinge joint connecting three bones: the femur, your thigh bone at the top, the tibia, your shin bone at the bottom, and the patella, your kneecap, at the front. Between the femur and tibia sit two C-shaped pieces of cartilage called the meniscus, medial on the inside and the lateral on the outside. Now, these act as shock absorbers. The ends of all three bones are covered in articular cartilage, smooth, slippery tissue that allows the joint surfaces to glide over each other with minimal friction. Osteoarthritis, the most common cause of knee pain in people over 50, is essentially the gradual wearing of this articular cartilage. As it thins, the bones come closer together, movement causes more friction, inflammation sets in, pain follows. Now, here is the important part. Cartilage thinning on an X-ray does not automatically equal the level of pain you feel. There are people with severe cartilage loss on X-ray who have mild pain, and people with moderate cartilage loss who are in significant pain. Why the difference? Three factors. One, the strength of the muscle around the knee, particularly the quadriceps at the front of the thigh and the hamstrings and glutes behind. Strong muscles absorb force before it reaches the joint. Weak muscles mean every step, every stair, every sit to stand goes entirely through the joint. 2. Inflammation. The presence of inflammatory chemicals inside the joint fluid directly amplifies pain signals independent of structural damage. 3. Movement patterns and joint loading. How you move, your gait, your posture, how you get up from a chair, how you walk determines how force is distributed across the knee. Bad loading patterns cause concentrated stress on already damaged areas. Good movement patterns spread load over evenly and protect those areas. All three of these can be improved with the right work, regardless of your age or your X-ray report. Now, the main mistake, the one I referenced in the title, and it is not what most people expect. It is sitting for long periods without moving, not squatting, not stairs, not walking. Sitting. Specifically sitting in one position for 45 minutes or more, repeatedly throughout the day, which is what most Indians above 50 do. Whether they are working, watching television, reading, or resting the knees as advised. Here is what happens when you sit for extended periods. Your quadriceps, the muscles at the front of the thigh that are the primary protectors of your knee joint, go neurologically quiet. They particularly switch off. The research term for this is arthrogenic muscle inhibition. Your brain, sensing pain or threat in the joint, suppresses the action of surrounding muscles as a protective reflex. Simultaneously, the synovial fluid in your knee becomes static. The cartilage receives no nutrient circulation. The hip flexors, the muscles at the front of your hip, shorten and tighten. This changes the alignment of your entire lower limb and alters how force travels through the knee. And when you finally stand up after 45 to 60 minutes of sitting, you now have particularly inhibited quads, tight hip flexors, and a joint full of static fluid. You stand up and put your full body weight through a mechanically compromised knee. That is the moment of peak pain that most people experience. That stiffness after sitting, that ache when you stand up, And then, because it hurts, you sit back down and the cycle continues. The fix is not dramatic. It is not a treatment or a surgery or a supplement. It is simply this: break up your sitting every 30 to 40 minutes, get up, take 10 steps, do 5 to 10 gentle knee bends, even partial ones, sit back down. This one change, interrupting the prolonged sitting with 2 minutes of movement every 30 to 40 minutes, has been shown in research to measurably reduce knee pain and stiffness in people with osteoarthritis within 4 to 6 weeks. It costs nothing. It takes 2 minutes, and most people with knee pain are not doing it. While we are here, let me go through the other mistakes I see constantly in people above 50 with knee pain. Mistake number 1: stopping all exercise because the knee hurts. A 2019 systemic review in the British Journal of Sports Medicine, covering over 4,000 patients with knee osteoarthritis, found that exercise therapy, especially strengthening the quadriceps and hip muscles, reduced pain by as much as an anti-inflammatory medication, with none of the side effects and with benefits that lasted long. Exercise is not optional for knee health. It is the primary treatment. The question is which exercise, how much, and how to progress safely. That is what needs guidance. Mistake 2: avoiding squatting completely. Squatting is a natural human movement. Indian squat, deep squat, heels down is actually excellent for knee joint nutrition and hip mobility when approached progressively. Many people are told never to squat after arthritis diagnosis. This is outdated advice. A partial squat going down to where there is no pain, even if it is just a few degrees, done consistently is therapeutic, not harmful. Mistake 3: relying on painkillers and anti-inflammatories. Diclofenac, ibuprofen are the most commonly prescribed medications for knee pain in India. They are effective at reducing pain short term, but there is an important issue. A 2021 study in the journal Radiology found that long-term NSAID use in people with knee osteoarthritis was associated with faster cartilage loss compared to those who did not use them regularly. Pain was masked while damage potentially progressed. This does not mean never take a painkiller. It means relying on them as the primary solution while avoiding movement and strengthening is the wrong strategy for long-term outcomes. Mistake 4: wearing thick cushioned footwear thinking it protects the knee. Very thick, heavily cushioned soles actually reduce proprioception, your body's ability to sense joint position. This worsens balance and changes gait mechanics in ways that can increase knee stress. A moderate, supportive shoe with good arch support is the goal, not a maximally cushioned sole. Mistake 5: focusing on the knee when the problem is often elsewhere. Tight hip flexors, poor ankle mobility, flat feet. All of these alter the alignment of force through the knee. Many people do specific knee exercises for months and get limited improvement because the root cause is a weak hip or a stiff ankle, not the knee itself. Let us get into what to actually do. Straight leg raises every morning before getting out of bed. This is the single most important exercise for someone with knee pain. Lie on your back, bend the other knee slightly for support. Tighten the thigh muscles of the straight leg. You will feel the quadricep engage. Slowly raise that leg to about 45 degrees. Hold for 3 seconds. Lower slowly. 10 repetitions on each side every morning before you stand up. Heel and toe raises, standing at a wall. Stand facing a wall with your fingertips lightly touching it for balance. Slowly rise up onto your toes. Hold 2 seconds. Lower slowly, then rock back onto your heels, lifting your toes. Hold for 2 seconds and lower. 10 repetitions each, twice a day. Warm water therapy, the most underused tool. A warm water soak for 15 to 20 minutes in the evening helps reduce joint stiffness, improves local circulation, and relaxes the muscle around the knee. Partial chair squats. Do not push through the sharp pain. A mild ache is acceptable. 5 to 8 repetitions once a day. This is called an assisted partial squat. It builds quadricep strength with the chair, providing a safety margin for how far you go. Standing hip abduction at a wall. 10 repetitions each side. This further builds the hip abductors, the unsung protectors of the knee. Nutrition for the knee health. Collagen supporting foods. Cartilage is made primarily of collagen. Your body produces collagen from amino acids, particularly glycine and proline, combined with vitamin C. Bone broth, if you eat non-vegetarian, is an excellent natural source of collagen. Otherwise, vitamin C rich foods like amla, guava, bell peppers, and citrus fruits provide the raw materials for collagen synthesis. Collagen supplements, particularly hydrolyzed collagen peptides, have shown promising results in multiple clinical trials for reducing joint pain. Omega-3 fatty acids. Omega-3s reduce joint inflammation directly. Flax seeds, walnuts, chia seeds for vegetarian. Fatty fish, mackerel, sardines, salmon. For non-vegetarians, omega-3 supplementation significantly reduced joint pain, stiffness, and the need for pain medication in people with arthritis. Maintain a healthy weight. This isn't about appearance. It is pure biomechanics. Research from Johns Hopkins University found that every kilogram of body weight lost reduces the load on the knee joint by approximately 4 kilograms per step. So, losing 5 kilograms removes 20 kilograms of force from your knees with every step you take. The impact on pain and cartilage preservation is enormous. Vitamin D. Vitamin D deficiency is extremely common in India and is directly linked to increased arthritis pain and faster cartilage deterioration. Get tested if you are deficient below 30 mg per millimeter. Supplement under medical guidance. 2000 to 4000 IU daily is the commonly recommended range for deficient adults. Let me show you how these habits stack into a real day. Morning, before getting out of bed, 10 straight leg raises on each side, take 3 minutes. As you start the day, 1 glass of warm water. Morning, 20 minutes flat walk at a comfortable pace. Wear appropriate footwear, not zero, not intense, just consistent and comfortable. Throughout the day, every 30 to 40 minutes, just stand up. 10 steps, 5 gentle knee bends, sit back down, 2 minutes every time. Afternoon, once a day, chair partial squats, heel and toe raises, 15 minutes total, not a workout, just a specific targeted exercises. Evening, warm water, soak for 15 to 20 minutes, dinner that includes protein, turmeric in the cooking, and omega-3 sources. Before bed, 1 glass of warm turmeric milk, haldi doodh. Genuinely useful for joint inflammation, not just tradition. This is manageable, this is realistic, and this is what actually moves the needle. I need to be responsible here. If you have any of the following, see an orthopedic doctor before starting an exercise program. Sudden severe swelling of the knee joint. This can indicate an infection or acute injury. A locked knee where the joint will not straighten or bend past a certain point. Pain that is severe at rest, not just with movement. A history of ligament tears or previous knee surgery. Knee pain accompanied by fever. This can indicate septic arthritis, which is a medical emergency. For people with confirmed osteoarthritis who are starting strengthening exercises, stop if you experience sharp shooting pain during an exercise. Mild ache during the movement is often acceptable and accepted. Sharp pain is not. Know the difference. And please, a full knee assessment from a good physiotherapist, not just an orthopedic surgeon. Physiotherapy for knee osteoarthritis has level 1 evidence behind it, meaning the highest quality of research supports it. In many cases, it is more effective than surgery. Knee pain changes your life quietly. It stops you from going on walks you used to enjoy. It makes you feel older than you are. And the worst part is being told, just rest, just manage, just accept it. You do not have to accept it. Not yet. not without trying everything that is actually evidence-based and within your control. Your muscles can get stronger at 55, at 60, at 70. Research is clear on this. Muscle responds to the right stimulus at any age, and stronger muscles mean less pain, less limitation, more life. I have seen this transformation happen to our members at odds more times than I can count. People who came in thinking their active lives was over, who are now doing things they thought they had given up permanently. You are not done, not by a long way.